benefit, obviously, of taking in a lot of the really great presentations yesterday so that I could go back to my hotel room last night and changed everything I planned to do. So I haven't actually run through this. So this will come a bit as a surprise to me as well as it may to you. There's a few things in here I'd plan to say, but I'm trying to build a little bit on some of the things that were said yesterday, because I took a number of things out that happily a number of other people have already made reference to, and are certainly exemplary for the types of work that we've been doing more recently. So what I'd like to do first is basically start with this question, because it really sort of underpins a reflection on what is now almost 20 years of the CIW when it got started, the Atkinson Charitable Foundation, back in 1999, when the chair of their board at the time asked what appeared to be a fairly simple question: what would it take to actually measure well-being? And it was raised out of frustration with what we've been talking about here, GDP as a measure of progress, and recognizing that it simply wasn't, and wanted to move on beyond that. So that started that whole conversation back then. As you heard yesterday as well, there's a couple of people in the room that in the early days of its development, Ron Coleman and Mark Anielski, were important advisors to the project when it was getting off the ground. And I'd like to tell you a little bit about its trajectory now and where we've come, and some of the challenges that we continue to face. But in Jeff's slide, that glass half full, I tend to be that way, and I'm rather optimistic about some of the signs we see despite some of the challenges that we face. But the question becomes, have we created conditions for policy change in the efforts that we've made? And based on Anders' comments yesterday, I decided I am a fantasist reformist. I really did believe in the early days that the indicator approach would in fact be caught up and be taken on by others, and I wanted to see those sorts of change happen. And I'm going to blame that on our previous co-chair of our advisory board, the Honorable Roy Romano. He was used to opening doors, and he did, but I think when we started releasing these reports, he believed that government would really pick up on it and see this as a new pathway forward. And I share his frustration that things haven't gone exactly as we fantasized in early days, but we're still optimistic based on some of the things that are going on now. So let me give you a little bit of context how we got started. And this is part of the reason I think that we've had some appeal, particularly with a number of different groups that I'll describe later. The project got started with focus groups, consultations with Canadians across the country, and this distinguishes the CIW from a lot of frameworks in that it's not built on what data do we have and let's construct a framework around it. And it tends to get populated and dominated by economic and some health indicators and so forth. These focus groups went in with a simple question: what makes your life good? What contributes to your quality of life? And based on those literally thousands of pages of transcripts, we were able to derive what became the 8 domains of our framework. And that was a long iterative process to get there. But they really are informed by what Canadians have said. These are the things that matter to us. These are the things that actually contribute to higher or detract from our well-being. We went from that phase into a phase of consultation and work with research groups from across the country that had specialties in those 8 domains to basically deconstruct them a little bit and say, what's the underpinnings of these ideas that Canadians have told us about, the underlying dimensions and so forth, and then importantly, what data are out there that we could actually use, identifying indicators where the research literature has consistently shown either contributions to or detractions from well-being. So we didn't want these ambivalent ones that it was a little unclear that, if this went up, well-being went up, sometimes it went down. That wasn't what we wanted. So that was a lengthy process as well to identify those, and sometimes, particularly in the social indicators and the environmental indicators, and interestingly even in education on a pan-Canadian level, difficulty in finding the kind of data that really reflected the conceptual underpinnings of the framework. So this is where we've gotten to now, and we report on 3 levels: the overall index, a dashboard approach by reporting on each of the domains, and then importantly at each of the indicator levels as well. So 64 indicators, 8 within each of the 8 domains, and then an overall index of well-being that was used to serve as a complement to the reporting on GDP. So as part of that process, we wanted to ensure as well that we made it fairly clear what the conceptual definitions were of the domains, what their dimensions were associated with it as well. So on our website, we have these full definitions. So within community vitality, it's built on social relationships and social norms and values, and there are some dimensions associated with those, which we also describe. And then we also describe, for example, within the social engagement dimension of community vitality, one of the indicators, sense of belonging, and then report on it. We say, here's what we see happening right now, and this is why this indicator matters to our well-being. So we've tried to be fully transparent about what we've described here and how it actually plays out. So we've had 3 national reports completed. The last one we released in November of 2016. We're planning another soon. It really is dependent on the availability of data so we can make a meaningful update on the index. But our reports, how are Canadians really doing, that was really the focus of the early days, is to get to the point of releasing an index that we could put up and put up against GDP. And that's really where our focus was. We hadn't really thought, to be quite honest, beyond that in terms of what would happen thereafter. So the report, you saw this in one of the presentations yesterday. We've never made any claims that our composite index is somehow an important metric from the standpoint of, here is a precise value of the well-being of all Canadians. This is a conversation starter. And it allows people to say, how are we doing? What kind of progress are we making? And how does that compare to what we see in GDP? Not that we should see them match lockstep into the future, but rather, wouldn't you expect that our well-being would continue to make progress if GDP really was a measure of floating all boats, if you will? You can see the impact there of the recession and the economic crisis in 2008, the effect it had on our well-being, and the recovery for well-being has been slower than for the economy. Here's a breakdown by each of the domains, and you can see that they respond differently. Education continues to track upwards. That second line, solid sort of bluish line, below that is living standards. So that's the lived experience that people have in terms of economic, housing, food, security, and you can see it has not recovered since the recession. So people's experience with those issues does not respond in the same way that the economy has. And I won't show you here, but obviously we have indicators that show these same sorts of patterns, upwards and downwards, within each of the domains. And those are the actionable things that people can respond to. One of the things we discovered in the early days, and again, this is the fantasist in us, is that we released a report and it was like, okay, here it is, this is what's happening, what are you going to do about it? Not even really sure who that audience would be. So what we subsequently did is that we convened focus groups with experts in all 8 domain areas before releasing the report and shared the data with them and said, we'd like you to come up with innovative social policy directions, suggestions that unifies what you see across all the domains. So not just in your specialty area to avoid one solution for every problem, but a solution that might cut across the domains that have a more meaningful impact in people's lives. And so basically these suggestions and directions were intended to provide, whoever was reading this, whether it's Canadians to advocate for change or government officials, to see where the sentiments were from a collection of people. And the main one that came out of this exercise and the last one was the recommendation on a universal basic income. And not just because it's proven effective for reducing poverty, but it gives people choice. It creates access, and it cuts across all the domains within our framework. So I think that was an important initiative. One of the things that we hadn't anticipated is that the interest that this would spark across the country at different levels of geography. And so subsequently, we've been doing provincial indicator reports. One in Ontario was the first one, in Nova Scotia this just past year, and I just submitted the Saskatchewan last week to the group we're working with there, which breaks down all of the indicators provincially and compares them nationally as well, so provinces can see how they're doing. And that's important because they very often have the jurisdictional responsibility for many of the things that are reflected in each of the domains. We then got asked, can you do this at an even lower level of geography? So we've done a series of regional reports in Ontario. It's broken into 5 regions, basically. There's North, there's West, there's East, there's Central, and Toronto as a region. And, but this allowed people to sort of see how this worked. But one of the things we are increasingly facing, and we knew this earlier on as well, is that the data starts thinning out as you get down into lower levels of geography. So we had to, build in new indicators for these reports based on provincial data that was available primarily and other sources. The Oxford County one is interesting because it actually is a hybrid in a sense. It's a combination of both indicators as well as our survey approach. And I'd like to tell you that we developed our community well-being survey because I had this incredible intellectual epiphany. It was really kind of a duh moment. We can't get the data locally, so why don't we just ask the residents of community how well they're doing according to all of the things pertaining to our framework. So the survey was designed to touch on issues related to community vitality, volunteering, social support, connections to the community, and so forth. So all of those types of indicators across the spectrum of ideas within a quite lengthy survey, a whole battery of demographic characteristics so that we can break it down by subgroups within the community, but also importantly, 3 different measures of well-being. One that we constructed and validated ourselves is a range of items pertaining to all of our 8 domains, and then the 2 measures of eudaimonic and hedonic well-being from the OECD. So that allows us to see how all of the indicators that people report on connects to whether or not they're above, below well-being, and identify those levers and triggers within the community that might actually bring about the kind of change the community wants. And this has really been where the greatest impact we've seen in actually bringing about change. And I'll say a little bit more about that. As I mentioned, Oxford County, the reason we started working with them, this is a mostly rural county just west of Toronto. They had developed a community sustainability plan with fairly ambitious goals for themselves, and they wanted a way of sort of tracking progress to achieving those goals. And they saw that our community well-being survey actually touched on a lot of the issues that their sustainability plan did. So they're using that as a way of monitoring progress forward. The Chief Medical Officer in Ontario just released a report and embedded a lengthy section in about the importance of community connections in it to people's health and well-being within Ontario. And just recently we've been engaged with Yukon. They have a performance plan now that is not dissimilar from what Scotland's been doing with its national performance framework, using the indicators as a way of tracking their progress towards enhancing well-being of the residents of Yukon. And they're interested in not just an indicator report, which is, again, a mix of our national indicators and data that they have in the territory, but they're also planning on doing the well-being survey across the territory in the coming year as well to blend those ideas together, like the Oxford County one. Some of the non-governmental adopters and community alliances, the Alliance for Healthier Communities in Ontario is using it as a framework for delivering healthcare through their health centers, which serve mostly lower income, new immigrant families, across the province. They see it as a way of not just applying a Band-Aid to illnesses, but understanding people's lives and helping refer them to areas that will actually improve their well-being. The Ontario Trillium Foundation, I can't really say whether or not they still have this because of our rather insane premier we've got right now. Oh, sorry, that come out loud? But with all the cuts that are going on right now, there's lots of programs in Ontario that are being cut. But the Ontario Trillium Foundation, it's funded primarily through the lottery programs there, and they give out about $100 million a year to communities to advance well-being in their communities. So they've embedded our framework into their granting strategy as a way of deciding where will they have the greatest impact. And also several community consortiums that are mixes not only of municipal governments, but of social services, police services, health units, education, and so forth, come together as a group. So some examples: Waterloo Region, 3 cities and 4 rural townships, Aurelian area, and also Wood Buffalo, principally Fort McMurray, are using the data from the Community Wellbeing Survey in particular to inform strategic planning as a way forward. So, you could argue that this is a connection and adoption by government, may not be at the national level, but we're seeing that the grassroots kind of impact is starting to percolate up, and it's getting more and more attention at regional, provincial, and even at the federal level. Importantly, and you'll hear more about this from Danny, is Engage Nova Scotia, and they also have a consortium of partners. They've done the indicator report that was mentioned yesterday briefly, and the survey is actually active in the field right now, with several thousand people already responding and many more anticipated, and that will work forward towards that as well. Now, I don't want to overreach with this, but not necessarily adopting, but consulting, but it reflects the growing awareness within government of the work that we do. I was invited to one of the, or to the sort of, working or strategy workshop for the development of the Canada's first national poverty reduction strategy. And it was me and 8 economists, and bright guys, right? But I really didn't quite understand what they were talking about, to be quite, 1% change in debt to income ratio would have this impact, whatever. Anyway, what importantly for me is that not only was I there, was invited there, but a lot of the questions I got were from the people on the advisory council who are actually living in poverty. And one of the things that they said is that it's not just about low income, it's about the way we want to live our lives and raise our children and so forth, and have the kind of access that other people have. It's about our well-being. And so the policy brief that we provided about taking a broader perspective, I'd like to think would have some influence on the way that the poverty strategy is looking beyond just market basket, what they've decided now to be the low income measure, but a lot of aspects of people living in poverty and how those things might be addressed. And that wordle that's there is just a reflection of a lot of the policy briefs and how it actually cuts across more than just poverty for low income. One of the others is we've been talking now with the group in the federal government, a couple of people here. Ugo is here. And this is where I don't want to overreach, but I think, I'm really flattered to even be part of the conversation as the federal government looks at indicator framework for its sustainability goals. And actually, a couple of years ago, we actually did this mapping exercise because the whole connection to sustainability, had really come up on this. So we mapped our indicators to the goals, and we cover a lot of the things in the targets that are being addressed in those goals. So I just want to finish with a couple of the challenges that, upon reflection, as I look back on where we've come and what we're still facing that are our challenges. And I think one of them is knowledge mobilization. There's a lot of talk of putting this stuff out there, but how can we turn it into action? And, I've had this conversation with Danny and Nancy at Engage Nova Scotia about, the gap that we see is that, we generate the knowledge and we provide the data and so forth. They've got the chops on the ground, the connections, the relationships. They really know how to work with people. But there's that piece in the middle that's missing about how do we actually turn those data into sort of actionable steps that will actually make the change that is really desired within the community. And the other one is culture change. And this one was mentioned yesterday as well. And this is, pointing a bit, more so to governments, but I think this is true for a lot of institutions, and we're working mostly with foundations and not-for-profits and municipal governments now, but there is a tendency to continually rely on what always has been done. And it really reminded me of this quote from Thomas King, scholar, Indigenous scholar here in Canada, and this part of the quote is fairly familiar, but if we want to change the culture, if an individual, one of the definitions of insanity is doing the same thing over and over again in the same way and expecting different results. For government, this is called policy. So I just want to leave you with what has become our sort of mantra now. If we really want to see positive social change, let's place well-being at the center of policy development. Thank you.